at almost every turn, and no conversation that the president is willing to have about changing the liability system. So there will be a continuation of practicing defensive medicine. And these are professionals and people who care for us that really feel greatly exposed right now.
We have a caller from Chicago on the Republican line. Joe joins us this morning. Hi, Joe.
Hi. Yeah, I just had a comment, and I was wondering if you guys, what you guys thought about it. I think the smartest thing would be if, you know, instead of just acting out on these crazy plans or something, if they would test it out on like a county, you know, for a couple months or something, and see how everybody's working. Maybe they could tweak it out that way instead of just throwing it out there. You know, give it a chance to work somewhere small. You know.
Joe, you make a good point, and that is that we've got the benefit of a federal system. We've got the benefit of being able to stage different types of things, and we've seen where different states have tried various programs over the years. Remember, welfare reform was actually something that took place in Wisconsin originally and bubbled up from there and began to transform the whole country. So I think you make a wise point that before enacting some massive program, the likes of which you can never pull back from, why don't we creep and crawl and walk so that we keep the elements of a current system that are actually good and robust, but actually try and drive towards getting at those things, particularly containing costs and increasing accessibility that I think all Americans are interested in.
On the Democrats line, Jane joins us from Allenhurst, New Jersey.
Good morning.
Good morning.
And good morning, Congressman Roskam.
Good morning, Jane.
My personal doctor, my general practitioner, he also does no longer can enjoy treating his patients. He had to give up his private practice and join a group because it required a staff of 15 to take care of the paperwork involved with dealing with the private insurance companies. I no longer see him. I see a nurse practitioner because he's allotted by the group about 3 minutes per patient. We all are one catastrophic illness away from financial ruin unless we're sitting on over $1 million of liquid assets because of the cost. And the cost is skyrocketing because the private insurance companies are one of the, I think, the only industry that can fix prices. We certainly suffer from that in the state of New Jersey. Our cost of health insurance, when the price is mentioned, is referred to as Cadillac coverage. My coverage is no better than any moderate policy in the country. It's just that the cost is astronomical. The only way we are going to be able to bring costs under control is with a public option. As our President Obama says, that will keep the private companies honest and give competition, which all good conservatives believe in free market and competition.
Jane, I agree with you insofar as the notion of good, fair, and robust competition is a great thing, and it creates good advantages. I come from Illinois. Illinois has a reputation as a state, as it relates to insurance, as comparatively good. Now, that's not to say that there's not great challenges, but look, if we're going to have a public option, here's how a public option would need to be laid out, and this is something that I think President and the congressional Democrats are unwilling to do. They're unwilling to let it come in and have the same capital requirements, for example, as a private insurance company, or they're unwilling to let it go according to the same state mandates. In New Jersey, you know, the mandated coverage that the New Jersey legislature requires a health insurance carrier to offer drives the cost up. And so I think what we're seeing is sort of a rub. And if I, just to push the conversation a little bit as it relates to competition, it's one thing to have competition, but the government is not able to both compete and govern and be the referee in the system. And I think that's the real weakness in this approach. And the reason that the Democratic leadership in Washington and Speaker Pelosi is having such a tough time gathering support on this, and why Blue Dog Democrats are now writing public letters and joining with one another and saying, whoa, we didn't sign up for this, Madam Speaker. Now I'm paraphrasing, but we didn't sign up for this. And they are communicating a great reluctance, is because they've seen the past failures of Medicaid. They've seen the past failures in terms of reimbursement of Medicare. look at the fraudulent piece alone. I'd encourage you to go to my website, roskam.house.gov. I've got a Medicare alert that's up there. There's an estimate that as much as 13% of Medicare costs today is squandered just based on fraud and you know, an outright criminal enterprise. The Secretary or the Inspector General of Health and Human Services said that it is more lucrative in this country to come up with a Medicare fraud scam than it is to sell crack cocaine or even deal in stolen cars. So we've got to get a hold of the cost side of this thing before we put another burden on the American public.
We have a comment from Twitter. Roger writes, why do insurance companies have to play a role in the health care reform debate? They're the problem, not the solution. Well, what do you think the role of insurance companies should be?
Well, look, right now, here's the delicate balance, right? So we've got, according to the Lewin Group, which is has a reputation in Washington for calling balls and strikes and being a nonpartisan organization. They predicted that if the president's plan and Speaker Pelosi's plan comes to fruition, that is, if we have a so-called public option on the health care side, 120 million Americans are going to lose their private insurance coverage. And the fact is that those folks who have coverage, by and large, tend to be somewhat satisfied. Now, I'm not here telling you it's great, but by the same token, we've got to be careful of what we end up giving up. Now, in answer to the question of the Twitter comment, as it relates to insurance carriers, you're right. I mean, insurance carriers ought not to be able to cherry pick. Insurance companies ought not to be able to deny folks based on pre-existing conditions. I think there is a whole host of things that we can do in terms of insurance reform that doesn't ultimately end up creating a public option and really sucking all the life out of